Diabetes is a condition known also as insulin resistance. It's insulin resistance, but it's a spectrum. At the very low end, you have some mild insulin resistance, which we have ways of testing. As it gets worse, it's called like impaired fasting glucose, then pre-diabetes, and eventually diabetes. There are now modern medications along with lifestyle changes. Of course, lifestyle changes come first: weight loss, exercise, weightlifting, changing your diet, all of those things. Ask our cardiologists and nurse practitioners about it. That starts first. And then there are all sorts of fancy medications now that attack diabetes almost at its root cause, to where nobody needs to be on like whopping doses of insulin anymore. People start losing weight with these new GLP-1s and SGLT2s, as well as metformin type medications. There are all kinds of options out there. Many of the cardiac medications also treat diabetes. Sometimes we call that cardiometabolic syndrome or cardiodiabesity. And we call it cardiodiabesity because it's cardiac, it's diet, it's obesity, and it's diabesity. Diabetes, obesity, cardiology, diet, all that kind of together. So we call it cardiodiabesity now because those four things all mesh together to give people insulin resistance or diabetes. Luckily now we have ways of solving this problem as much more than we did in the past. And the problem with diabetes and insulin resistance is it 2 to 3 times, it increases your risk for cardiovascular disease 2 to 3 times what it would have been. If your risk was here, if we add on diabetes, now it's like 2 to 3 times more. So definitely the risk of heart failure, heart disease, heart attacks, strokes, dementia, all of these things, microvascular, vascular dementia, all these things do go up if you have uncontrolled heart disease, uncontrolled lipids, cholesterol, hypertension, smoking, and you tack on insulin resistance and diabetes. So hopefully that helps. Ask one of our providers on how we can help you with that.